Medicare Plan N is generally cheaper than Plan G, but the big question is, are you going to be able to stomach the downsides? A lot of people today are enrolling in the Medicare Supplement Plan N instead of the super popular Medicare Supplement Plan G because Medicare is becoming so expensive and Plan N is just more affordable.
Saving money.
So should you enroll in the Plan N? Well, there's a lot you need to know about a Plan N before you ultimately decide that you want to enroll in it. That's why in this video, I'm going to give you a brutally honest review of this plan, and by the end of this video, you'll have a much better feel for what is right for you. Let's start by looking at exactly what a Medicare Supplement Plan N covers compared to the Plan G. So first, here's the Plan G. As you can see here, if you're enrolled in a Medicare Supplement Plan G, your plan will cover your Medicare Part A deductible, which is $1,676 in 2025, and it covers your hospital copays for when you're admitted to a hospital, and also covers skilled nursing facility copays if you need rehabilitation after staying in a hospital. Over on the Part B side, which is the medical coverage for Original Medicare, Plan G covers the 20% coinsurance that you're usually responsible for paying out of pocket. It also covers any Part B excess charges you might run into, and take note of this because I'm going to come back to that here in a little bit. Really, the only gap in Medicare that Plan G doesn't cover is the Part B deductible, which is $257 in 2025. But once you pay that deductible, you're essentially done paying for the rest of the year when you have a Plan G. That's why a Plan G is so popular nowadays. Now, recent reports show that over 4 million people have a Plan G because of this coverage. However, one of the main caveats of the Plan G and the downside is that typically it has the higher premium. Now, I'll show you just how expensive it can be here in a bit, but this is really the main reason why plenty of people choose the Plan N instead of the Plan G. So here's what the Plan N coverage looks like. As you can see, Plan N still covers all the gaps in the Part A side, so whether you're admitted to a hospital or a skilled nursing facility, you don't have to worry about the deductible or the copays with the Plan N. However, over on the B side, you can see that the Plan N doesn't cover the Part B deductible and the Part B excess charges. It covers the 20% coinsurance for Part B items and services, but you'll have to pay a copay when you visit your doctor or if you go to the ER without being admitted to the hospital. Now, these copays can cost up to $50 for an ER visit and $20 for a doctor's visit. This shows us that while Plan N still covers a lot of your out-of-pocket costs with Medicare, there are a few more gaps when compared to a Plan G. So how can you tell if it's worth going for a Plan N over a Plan G? Let's take a look at 3 reasons why people choose a Plan N, and let's also look at 2 potential dangers of the Plan N. The first and most obvious reason why people choose a Medicare Supplement Plan N instead of a Plan G is because it has a lower premium. Now, the exact premium for a Plan N depends on several factors like where you live, what your age is, whether or not you use tobacco, and a few other things. All of this really depends on what state you live in because states also have their own rules about how Medicare supplements are priced. But to give you an idea, here's what the lowest price might look like in several states for a 65-year-old male who doesn't smoke tobacco. As you can see here, the prices differ greatly depending on where you live. In some places like Houston, if you're 65 years old, you can get a Plan N for $108 a month, while in a place like New York City, the cheapest Plan N could cost you $220 a month. So these numbers are just an example for you to reference, but the cost is going to be different depending on where exactly you live. But despite these differences, you'll find that the Plan N pretty much always costs less than a Plan G. In Los Angeles, the difference for the lowest cost plan is $34 a month, which adds up to $408 in savings if you choose a Plan N instead of a Plan G. But if you check the same prices in Miami, Florida, you'll see that you can save around $49 a month or $588 a year if you go with the cheapest Plan N instead of the cheapest Plan G. Now, in today's economy, with inflation and prices going up everywhere, $500 matters. I mean, $500 is $500. But remember, people who choose a Plan N have to be okay with spending $20 every time they visit the doctor or $50 for an ER because they're thinking, well, I'm not going to visit the doctor so much, and I'm going to save that $500 with the example of Florida. If I'm going to save the $500 and I'm not going to visit the doctor very much, then I'm still going to save money. But of course, there's one big kicker that I haven't talked about in detail yet, and that is the excess charges, which I am going to talk about here in a little bit. But anyway, if you can avoid the excess charges, people who don't constantly visit their doctors can save quite a bit in premiums by choosing a Plan N instead of a Plan G. Now, the second reason why people choose a Plan N over a Plan G is that the rate increases tend to be lower. So in case you don't know, Medicare supplement plans usually increase their premium rates every year. And what some studies are showing is that most insurance companies raise their Plan G premiums at a higher rate compared to a Plan N. For example, here's one study by Telos Actuarial. You can see here that one company's Plan G increased by around 5% in 2020, in 21, and 22, but then it jumped by 9% in 23 and 11% in 2024. Now, look at the same company. Plan N increases for this same company were much lower. In 2020, it was 2%. In 21, 4%. In 22, back down to 2%. Then in 2023, it jumped by 6%. And in 2024, a whopping 10%. But still, that's lower than the 9% and 11% that Plan G had in 23 and 24. Now, if you want to pause the video and compare the other company rate increases, go ahead. But what the study shows is that Plan N generally has more stable rates across the board. One reason for this might be that people who need a lot of expensive treatments tend to enroll in the better plan, which is the Plan G. And that's why insurance companies selling Plan Gs often have to pay for big claims because the people who've enrolled in it need a lot of services. This is called adverse selection, which means that the plan is being adversely selected by people who have the most health issues and who are going to have the most claims. And so that causes them to raise their premiums. That's why if you choose a Plan N instead, you're not only saving the money in premiums today, but you could potentially be saving more money as the years go by. Now, the third reason to choose a Medicare Supplement Plan N is that those scary Medicare Part B excess charges are actually quite rare. When you compare Plan N to a Plan G, the fact that the Plan N doesn't cover these excess charges can easily scare people. But in reality, Part B excess charges are rare. Now, let me explain what a Part B excess charge is so that you understand when they would come up. When a physician is allowed to charge you more than the Medicare approved amount, that is called an excess charge. Some physicians are allowed to charge up to 15% more than Medicare, and you are responsible for paying this excess charge 100% out of pocket if you have a Plan N. So if Medicare says that a service can cost $1,000, doctors who charge excess charges can charge you up to $1,150, and you'll have to pay the full $150 out of pocket. However, according to MedPAC's report to Congress, 98% of clinicians or doctors will charge the Medicare approved amount. So this leaves a mere 2% of doctors who may charge you an excess charge. So that means it's something that is not very common. However, in a moment I'm going to tell you a story about how you could end up paying excess charges in a place like an emergency room where you can't choose who the doctor is or who is treating you. Again, this is rare, but we have seen it happen. But outside of the emergency room, you can always ask your physician before you get treatment if they take Medicare and if they're going to charge you the Medicare approved amount or if they're going to charge you an excess charge. This way you can avoid the pesky 2% of doctors who may charge an excess charge. Okay, so those are the three reasons why you should get a Plan N instead of a Plan G. However, there are also two dangers of the Medicare Supplement Plan N. And these are the two reasons why most people still prefer Plan G over the Plan N. But before I get to that, let me just jump in here and say that if you're finding this video helpful, then please hit the thumbs up button. This not only supports our channel, but it also helps this video to reach other people who might be wondering if a Plan N is the right fit for them or not. Okay, now let me get back to the two dangers of the Plan N. The first danger of the Plan N is that it has relatively unpredictable costs. If you choose to enroll in a Plan G, figuring out how much you're going to spend on your healthcare over the year is relatively simple. All you have to do is calculate your premiums and then add in a $257 Part B deductible, and that will be your healthcare cost for the year no matter how many times you visit the doctor, no matter how many surgeries you have, or even if you have to go to the emergency room or be hospitalized. Now, of course, that is with the exception that prescriptions are not covered by your supplement, but that's true of all the supplement plans, whether it's a Plan G or a Plan N. However, with a Plan N, you can't quite predict how much you're going to spend in a year. Sure, you can make a calculated guess, but nobody knows when sickness or an accident or some kind of condition may come up. And if you visit the doctor over and over during the year, there's actually no limit to how much you can spend on the Plan N. That's why some people prefer having the peace of mind of a Plan G rather than the savings of a Plan N. Those people just don't want to have the stress of not knowing just how much they're going to end up paying in visiting doctors or being hospitalized over the year. The second danger is, of course, the excess charges. And you're probably asking yourself, didn't you just say that excess charges are so rare? Well, yes, they are rare. However, just because they are rare, it doesn't mean that they will never pop up unexpectedly. And when they do, they can get very expensive. For example, a few years ago, I had a client of mine that had a sudden heart attack, and he was rushed into the hospital, and fortunately, they were able to save his life, and he was okay. But when he came out of the hospital, he discovered that the anesthesiologist in the hospital charged an excess charge, and it was very expensive. Well, how would you know in a situation like that? How could you even ask? It seems unfair, but these types of situations can occur. And there can also be situations where you want to go to a very high-end or very exclusive clinic for some sort of treatment like cancer treatments, etc. Some of these clinics notoriously charge the excess charge because they are very sought after. And that's why it's very important that you double check that if the doctors or the hospitals or facilities that you want to see take Medicare, you want to check that they don't charge excess charges before you join the Plan N. Because being hit by one of these excess charges can potentially wipe out any savings that you made in premiums by choosing a Plan N instead of a Plan G. Now again, this is rare, but if you're enrolled in a Medicare Supplement Plan N, you always have to be careful. So now the big question, should you enroll in a Plan N? Well, I'll tell you, my honest opinion is if you're going to spend the money to have a Medicare supplement, you should consider the Plan G over the Plan N in most cases. If money is that tight that a Plan N is giving you the savings that you're looking for, and that's the only way that you can afford a supplement, maybe it's not the right path for you to take. Because the ultimate reason that you took a Medicare supplement in the first place is that you could go to any doctor that you wanted to go to that takes Medicare. You could go to any facility throughout the country, and you wouldn't have to worry about how much it costs. So my honest opinion is, if you're going to spend the money to have a Medicare supplement plan, then take the plan that gives you the most coverage. Okay, that's it. That's my brutally honest review of the Medicare Supplement Plan N. So before you make any decision, make sure you compare the costs of a Medicare Supplement Plan N to the Plan G in your area. And the best way to do this is by contacting a licensed insurance agent or broker who can help you compare plans at no cost to you. And of course, our team here at PlanFit, that's exactly what they do. And they are paid salaries, not commissions. So they have no incentive to push you to one particular plan or to push you in any direction that benefits them financially. Instead, our team will go over all of your needs, compare all of your options, and help you find the best plan for you. So if you need help, call our team of licensed insurance agents here at PlanFit at 877-360-6565, and we'll be happy to assist you. Also, if you want to see my brutally honest review of the Medicare Supplement Plan G, you can check that out over here as well. Other than that, thank you for watching, and we'll see you on the next one.